Hi everyone, welcome back to Learn Conversational English. I'm Isabella, and I'm here with my friend Marco. Today we're talking about health and doctor visits. Super important vocabulary for anyone living or traveling in an English-speaking country.
Hello everyone. Yes, and this topic is so practical. Even if you're generally healthy, you might need to visit a doctor or pharmacy at some point. So, Isabella, let's start with something basic. How do you make a doctor's appointment?
Good question. So when you call a doctor's office, you usually say something like, "Hi, I'd like to schedule an appointment with Dr. Smith, please." The receptionist might ask, "What's this regarding?" And you can say, "I have a sore throat," or "I need a checkup."
That's helpful. And what about confirming the appointment? I always forget to do this.
Oh, confirming is important. You can call and say, "I'd like to confirm my appointment for tomorrow at 2 p.m. with Dr. Smith." They'll usually say, "Yes, we have you down for 2 p.m., or they might need to reschedule.
Perfect. Now, the tricky part, describing symptoms. This can be really challenging for English learners because you need specific vocabulary.
Absolutely. Let's practice some common ones. For a cold, you might say, "I have a runny nose and I'm congested." For the flu, "I have a fever and body aches." For a headache, "I have a splitting headache," or just, "I have a bad headache."
Those are really useful phrases. What about describing pain levels? Doctors often ask about that.
Good point. You can say it's a mild pain, moderate pain, or severe pain. You can also use numbers. On a scale of 1 to 10, it's about a 7. And describe it. It's a sharp pain, or it's a dull ache.
That's really helpful. But I think we should also talk about timing and duration. Doctors always want to know when symptoms started and how they've changed over time.
Absolutely. Time-related vocabulary is crucial. You might say, "I've had this headache for 3 days. The pain started yesterday morning," or "It's been getting worse since last week." You can also say, "It comes and goes," or "It's constant." If it's intermittent, you might describe when it happens, mostly in the evenings or especially when I wake up.
And let's not forget about describing different types of pain more specifically. Beyond sharp and dull, you might need words like throbbing, stabbing, burning, or cramping. For example, "I have a throbbing headache," or "there's a burning sensation in my chest." That's very clear. Now let's talk about something equally important, getting prescriptions at the pharmacy. The vocabulary can be quite specific there too.
Yes. So when you go to the pharmacy, you say, "I have a prescription to fill," or "I need to pick up my medication." The pharmacist might ask, "What's your date of birth?" for verification. They'll also explain how to take the medicine.
And understanding those instructions is crucial. What are some common ones?
Common instructions include, "Take 1 tablet twice a day," "Take with food," "Take on an empty stomach," or "Apply to affected area." They might also say, "Don't drive while taking this," or "Avoid alcohol."
Those are really important to understand. Now, I want to touch on something that's becoming more common to discuss, mental health. How do you talk about stress or anxiety in English?
That's such an important topic, Marco. You might say, "I've been feeling really stressed lately," or "I'm dealing with a lot of anxiety." You could also say, "I'm feeling overwhelmed," or "I'm having trouble sleeping because of stress."
Those are good examples, and it's okay to ask for help. "I think I need to talk to someone," or "Could you recommend a counselor?"
Absolutely. Mental health is just as important as physical health. Doctors are trained to help with both, so don't hesitate to bring it up during your appointment. Before we do a role play, Marco, I think we should talk about preparing for your doctor visit. Many people forget important details when they're nervous, so it's great to come prepared.
That's excellent advice. You can say, "I brought a list of my symptoms," or "I wrote down some questions." Common questions might include, "What do you think is causing this?" "Do I need any tests?" "How long should I expect this to last?" Or, "Are there any lifestyle changes I should make?"
And don't forget your emergency contact information and medical history. You might need to say, "My emergency contact is my sister Maria," and give her phone number. For medical history, you could say, "I have a family history of diabetes," or "I'm allergic to penicillin." It's also helpful to bring a list of current medications.
Perfect. Now let's put all of this into practice with a role play. Isabella, can you be the patient calling to make an appointment?
Sure. Hi, I'd like to schedule an appointment with Dr. Johnson, please. I've been having headaches for the past week.
Of course. How about Thursday at 10:30 a.m.? And just to confirm, you said headaches. Are they severe?
Thursday at 10:30 works perfectly. And yes, I'd say they're moderate to severe. About a 6 or 7 out of 10.
Perfect example. See how natural that conversation flows when you have the right vocabulary?
Now let's try a pharmacy scenario. This time, Marco, you can be the patient picking up a prescription, and I'll be the pharmacist.
Okay, hi. I'm here to pick up a prescription for Marco Rodriguez. My date of birth is June 8th, 1985.
Yes, I have that ready. It's your blood pressure medication. I see you requested the generic version, which will save you about $15 compared to the brand name. This should be taken once daily in the morning with or without food.
Thank you. What are the possible side effects I should watch for? And what should I do if I experience any problems?
The most common side effects include dizziness, especially when standing up quickly, and mild fatigue. If you experience severe dizziness, rapid heartbeat, or difficulty breathing, stop taking the medication and call your doctor immediately. Here's an information sheet with all the details.
Excellent. That pharmacy role play shows how important it is to ask about generic versus brand name options and side effects. Now, Isabella, let's talk about something that often comes after doctor visits, follow-up appointments, and getting test results.
That's such an important topic. For follow-up appointments, you might hear, "Come back in 2 weeks," or "I'd like to see you again in a month." You can ask, "When should I schedule my next appointment?" Or, "How long should I wait to see if this treatment works?" If you need to reschedule, say, "I need to change my follow-up appointment."
And what about getting test results? That can be really nerve-wracking, especially if you don't understand the medical terminology.
Absolutely. You might hear, "Your results came back normal," or "We found something we need to discuss." Don't be afraid to ask questions like, "What do these numbers mean?" "Is this result concerning?" Or "What are the next steps?" If results are abnormal, ask, "What does this mean for my health?" And "What treatment options do I have?"
Before we wrap up, I want to return to mental health vocabulary for a moment. We touched on this earlier, but there are more specific phrases that can be really helpful when talking to healthcare providers about your emotional well-being.
That's so important, Marco. You might need to say, "I've been having panic attacks," "I'm experiencing mood swings," or "I've lost interest in things I used to enjoy." For sleep issues, you could say, "I have trouble falling asleep," or "I wake up frequently during the night." And for concentration problems, "I can't focus at work," or "My memory isn't what it used to be." I hope today's episode helps you feel more confident about health-related conversations in English. Remember, it's always better to ask questions if you don't understand something. Your health is too important.
Exactly. And don't forget, practice makes perfect. Try using some of these phrases when you're at home. Even role-playing with a friend can help build your confidence before you actually need to use them.
That's such a great point, Marco. The more you practice these conversations, the more natural they'll become. And remember, healthcare professionals are there to help you. They want to understand what you're experiencing.
Well, that's all the time we have for today's episode. Thanks for joining us on Learn Conversational English. I'm Marco.
And I'm Isabella. We'll be back next time with more practical English to help you communicate with confidence. Until then, keep practicing and take care.